Fran Sharples had asked me to wrap up, which I thought was very bold and risky. I have no intent of trying to summarize or capture what such an esteemed panel as this has presented, but I do think that we owe you, who are not on ILAR Council now, but are either alumni, or supporters, as to what the Council is projecting and planning to do, at least in the near future. And then I'll follow up that with some notes on lab animal care and use going forward. These are personal observations or questions and should not reflect the opinions of my employer, any association with which I'm associated, or friends and colleagues. In terms of going forward, I think it's clear that we're committed to sustaining the ILAR Journal as a publication of excellence and value. Remarkable track record. There is no other resource that I'm aware of that publishes reviews on topics such as we do, and so here is a niche that we are committed to continuing to fulfill. We are also committed to more outreach to and support for lab animal care and use in emerging economies. And this was on our shopping list in advance of gaining OIE Collaborating Center status, but it clearly gives us a broader and a more powerful platform in which to do that. This is not only to help colleagues in those developing countries understand and apply the guide, but similar to the comments made earlier, to let them know it's okay to come up with alternative approaches within the guide that the latest edition embraces appropriately for performance standards that are data-driven. Thirdly, we are growingly embracing the reality that the word laboratory in ILAR refers not to something that has sinks and countertops, but it's a global laboratory now, and the use and evaluation and observation of animals on a planetary scale, with all the important knowledge that needs to be gained in that context, deserves our support and our investment. And then finally, it became clear in my last 3 years on ILAR Council that a new business model was desperately needed. When I joined, ILAR was on life support, if not terminal. Council members were exhausted, as was staff, on how to move forward when the old business model that had served them so well for 57 years was no longer sustainable. That is, to have somebody write a huge check to empower or convene a panel of experts that 6 to 18 months later would issue a thick publication that maybe 6 to 18 months after that was no longer timely or relevant. And so what alternative approaches were economically sustainable? Well, I'm delighted to say that ILAR has gone from life support to now critical status, so we've upgraded at least one level. And if the U.S. labor force was as productive, we're all working hard, but if they were as productive as Fran and Lita have been under very distressing circumstances, I think the unemployment rate would be 50%, because half of us would be doing the work of two. And so that needs to be recognized as well. Well, what do those new business model components look like, or what might they look like? Roundtables is a new initiative for which we're very excited. This is intended to be a flexible and timely and quickly reactive mode to a variety of topics that don't need 6 to 18 months of deliberation by only a few people. So we have organized a steering committee of sorts with people who are funding this initiative in order to participate, who will only select topics for roundtables. And for those of you who aren't familiar with this model, the academies and IOM have been doing this for a long time in other venues, where it's an open meeting with selected experts to present their perspectives as stakeholders or as informed parties with an intended lots of discussion, and the products of which will be something between that thick book and a merely edited transcript. So one can anticipate maybe multiple position papers coming out of these exercises. There will be no consensus report because that's too hard and takes too long, but the agility of this platform and vehicle is very attractive to us. We are now planning a virtual meeting of those planning committee participants and anticipate one or two, at a minimum, round tables that will be probably in the winter and the spring. And this is a financial and a social experiment for ILAR, but we see this as a much more reasonable and affordable and sustainable approach to revenues and costs. The second business model that we're exploring is with the guide. So between 1996 and 2010, there was nothing new published, while there was still lots of new understandings and approaches and realities in the field of lab animal care and use. And so is there a mechanism to create a living guide online that is always updated? So the 8th edition could be the last one ever put in a book form. And what type of jury do you need in order to referee those revisions that could occur on a monthly basis, for example? And what does that business model look like? Since the guide needs to be available at no cost to the research community. Well, a variation on that theme is to consider an annotated guide. So now that we are encouraged to embrace performance standards if they are effective, no one yet has had the guts to champion or publicize what they've done locally, either because there's no platform in which to do that or because they're afraid of attracting regulatory attention and getting overruled. If there was a website that had the guide with the basic print and then inserts in an infinite number of locations with an infinite number of variations, again refereed, that would give the community what local institutions have tried and approved. So maybe this requires local IACUC approval in order to be even submitted. What a wonderful tool that would be, perhaps in multiple languages, and certainly for multiple economic realities and for scientific needs. So these are some expansions or extensions of the guide that we're just starting to consider how to approach mechanistically at a very early stage. But rather than waiting for whenever to come up with something that is more current, we think this is very doable. It may elate OLAW and ALAC, it may give them more than heartburn. But again, these are not going to be submitted with the guarantee of acceptance by any outside agency. It is merely a very community-driven list of possibilities. And we're very excited to see how that evolves. Let me turn to lab animal care and use going forward. And I'm going to avoid the word challenges, but I am going to use two other C words, concerns and curiosities. We're clearly in an era of growing public concern about the use of animals in research, testing, and education. And rather than the old response, which I'll call a push or shove down your throat under the label of public education, I think we have to shift to public engagement. And that means engagement specifically with opponents. If those opponents are abolitionists, then there's really no engagement, there's no conversation. But if both parties are willing to recognize opportunities for progress and a common ethical platform, not with the intent of changing everybody's minds on everything and immediately. I think that has to be a shift in behavior from our side, because these are going to be public anyway, and they're going to be transparent anyway. And it's not to pull a fast one and now be seen as a better than one of the good guys when we were one of the good guys before. But again, given social media and globalization of instant communication and miscommunication, I think that's worth considering. There are other concerns, institutional stakeholder concerns, the organizations that have to foot the capital improvements to either comply or stay ahead of or even do the right thing when it comes to the more we know about animals, maybe the more expensive it does become. And then there are researcher concerns that Dr. Wingfield alluded to earlier with the bureaucracy and the moving target of compliance or even IACUC approval, as well as IACUC pace. And so getting back to public concerns and public engagement, again, we used to think that the importance of compliance and accreditation was sufficient testimony that we're doing the right thing. I'm not sure if the public is either going to get that interested or educated or even cares. And so that's going to be a problem for us while we continue to explore, hopefully, an infinite variety of solutions to a standard of ethics and a standard of protecting research. And then there are personal concerns, not just mine, but I hope everybody who is involved in this field. As I tell veterinary students, I'm in the hardest specialty in the field. We start with healthy animals, and occasionally we make them sick or injured. And sometimes we're doing that to understand the biology of disease or injury. And sometimes we're going to test new drugs, vaccines, or devices and try and make them better. No other specialty in this field does that. And so if it's easy for you to be in this field, please find another line of work. Either you've become too calloused or you've swallowed too much Kool-Aid and come to believe only one side of the story. So every day, every animal should be observed, but every animal should also be ethically evaluated per what's approved in the protocol. And I don't think we do enough of that. I think it's even more compelling these days based on what we're learning about emotions in animals and effective neuroscience. I wasn't trained, but I absorbed lessons in the past that we weren't supposed to use words like anxiety, suffering, and fear in animals, that we would talk about animals experiencing pain or experiencing distress, but because these were presumed to be higher order emotions, maybe for humans and apes only, that we were giving credibility that was unwarranted to opponents and making it worse for ourselves. If you're following the literature, though, that's just starting to become more popular with both human, rodent, and other mammal and even non-mammal species on the reality that fear and anxiety are actually lower brain centered, meaning more primitive, then we can now scientifically say it is accurate to apply these terms to other mammals at a minimum. And I always thought it was puzzling that for fear and anxiety bioassays, the rat was a very accepted model, but we couldn't use the words fear and anxiety. And so we can talk about animal suffering, perhaps not in the entire human response or understanding, but at least using lower brain commonalities as a model. It has to be both a model and a sentient experience for those animals. We can't have it both ways. So that's going to make it maybe harder ethically, maybe easier scientifically, but I see that looming on the horizon. With regards to the 3 R's, just to hit my final point, I clearly see an acceleration of refinement and reduction, but it's going to be harder to identify because the more we discover, the more we realize what we don't know. And so we have replaced pyrogen testing in rabbits for the most part, and we've replaced Freund's adjuvant and monoclonal antibodies in mouse abdomens for production. What are we going to learn tomorrow that we didn't know today that is going to beg for animal modeling in some fashion? Maybe it's not as invasive. Maybe it is a Category E approach. And so there is going to be a lot of churn under the surface of total animals used, and it's going to be hard to either quantify in detail or explain to the public. With regards to reduction, though, we spent a lot of time in the council meeting yesterday and today talking about opportunities for dramatic reduction in individual experiments, and this may be a roundtable topic, if we came to recognize the utility of historical controls instead of contemporary controls, negative controls, saline injected or whatever innocuous controls. And at what point, again, given sequestration and the growing expense against reduced funding of biomedical research and regulatory testing, is that going to look more attractive? Or, and not in conflict or mutually exclusive, what about shared controls? If I'm running 6 different experiments and they're all on rats from the same vendor with the same genetic background and they're all in the same building at roughly the same time, under the same ALAC accredited and compliant environments and standards, why can't I have one shared control group for all of those experimental variable groups? Sounds pretty logical. One other one that we didn't discuss, but personally I continue to think about, for regulatory submissions, we insist on 10 mice and 3 primates per group, or 6 primates and 20 mice. Since there's less genetic variability and environmental variability between mice, why aren't 3 or 6 mice per group just as acceptable biologically as 3 to 6 monkeys? Certainly mice are cheaper financially, but at an intellectual level, it continues to be a bit puzzling. And so I think that's grounds for more deliberation. In closing, not only was it humbling to be asked to do the wrap-up, it was sobering because I share the same birth year as Dr. Brown and ILAR. And so now we're at 60 years. But I think that this organization, with the new council's vitality, has turned a corner, and I'm very excited about what's on the horizon. So thank you today for coming, and enjoy the refreshments outside.